Good morning, Lori. It's so nice to hear your voice, and I hope you and your family are safe. As you just said, I'm really proud of New Yorkers for really being heroic and following the guidance and advice that's been given, and really is making a difference. So there are still tough days ahead, but our collective efforts, I think, are making a big difference.
All right. Can we talk, Corey, for a moment, though, please, about what's going on with the governor and the mayor as it relates to opening the schools or not, and this macho back and forth of who really is in charge of making that final call? Is that necessary, first of all? It's counterproductive. I was talking with Kirsten Gillibrand a little earlier, and she was saying, you know, until we get the city school open, we can't even begin to address reopening the economy for the state. What do you think? Do these guys need to figure it out?
Well, I mean, I think they are hopefully going to figure it out. Our main priority, and I know their priority, even though it may not have been communicated clearly a couple of days ago, I know everyone's main priority is to keep our city's students and educators and parents safe. And so the decision to reopen the schools or to keep them closed needs to be decided on the advice of medical professionals and scientists who can tell us what's actually happening right now. I do believe that the mayor and governor will figure out how to get that done, how to make that decision in a way that makes sense for 1.1 million school kids. This is one of the most disruptive things that we've ever seen happen for children across New York City. There are still too many kids who don't have the devices they need to do the social distance learning. So, you know, we need to make sure they get those devices. And I honestly don't think schools are going to reopen this year, and it's important to give parents the right information so they can plan accordingly. But this is one of the most painful things we've ever seen happen for the city as a whole, but especially as it relates to school communities and children. This is really hard on kids. Think of these seniors that were going to graduate high school and be together who can't be there. I want to think about them while at the same exact time giving parents and families the right information to stay safe.
You know, I know we have to be in the present, but you have to look back and wonder if we made some missteps along the way. I mean, early on, we heard the commissioner, health commissioner Barbeau, who was saying, you know, that the flu is worse than this. We're at low risk. We heard the mayor talking about we should live our lives. Even you were talking about go to Chinatown, support it. Why weren't we clued in from the beginning? Why were we playing catch up?
Well, you know, I am, of course, I'm not an epidemiologist, but I'll say this. Even though, as you mentioned at the beginning, I was a little bit ahead of some other elected officials with regard to saying we should close the schools, we should cancel the St. Patrick's Day parade, we should close restaurants and bars. All of us were too slow. Everyone was too slow. And part of the reason why there will be a time to do basically a forensic audit to look back and figure it out day by day. But the community transmission was so widespread and we didn't know it. And the reason why we didn't know it was because we were flying blind. We didn't have the level of testing needed to know how widespread that community transmission is. Community transmission is when you can't tell how someone got it. They weren't in a country that had it. They weren't close to someone who was in a country or that you knew was exposed. And so once it gets that far, you are way too far behind the 8 ball. And we're going to have a chance to go back and look at that. But I think all of us were too slow. And we need to figure out what that looks like for the future and what that looks like as we start to talk about what a potential reopening looks like. How do we potentially do that in a way? And how do we make sure we keep track in a way so that we don't make similar mistakes in the future? I don't think now we can figure all of that out about what went wrong in January and February and the beginning of March. Today, there'll be time to do that, but clearly we didn't have the correct information to make accurate decisions.
You know, we get these numbers of deaths, Corey. We know that, you know, they even opened up the trenches on Hart Island. I know you're calling for more funding, particularly for low-income communities when it comes to being able to shoulder the burial costs or cremation costs for these individuals. Many of them, of course, as we know, are on the front lines because they're in many of those occupations that are people to people. So you're working on funding for funerals and also food pantries.
Yeah, I mean, on funerals, it's so tragic that there are a lot of people who have lost family members who can't even afford to bury their loved ones. It's a tragedy on top of another tragedy. And so Councilmember Francisco Moya and myself, his district's one of the hardest hit districts in New York City, around Elmhurst Hospital in Queens, we've called for an emergency fund for final resting arrangements for all New Yorkers. HRA, the Human Resources Administration, has some assistance, but you need a social security number to actually get that help. And we know a lot of people don't have that, especially low-income communities and undocumented folks. We want everyone to be able to access the money to be able to bury their loved ones. On food pantries, Lori, I'm really worried about this. And the council got $25 million from the city last week in emergency funds for food access. The state put $25 million in the week before. 30% of food pantries have closed in the last few weeks because many of them are run by volunteers. And a lot of those volunteers are seniors and who are retired, who have to stay home right now. We need to get food out there to families that are really vulnerable right now and that have been really, knocked over by losing the employment overnight over the last month. So we're focused on food, getting money to those pantries and getting that food into people's homes who are really scared right now. We're going to keep talking about this in the weeks and months to come.
I know one thing. We've certainly seen so many people come out and help each other, though, in the community. I do feel we're more united than ever, don't you?
Oh, absolutely. I mean, this is one of the most difficult moments New York City has ever faced. But I will say, as a New Yorker and as someone who loves this city, we will get through this. It's painful. It's not easy. But this city got through the fiscal crisis of the 1970s. We got through 9/11. We got through the Great Recession of 2009. We got through Hurricane Sandy. This crisis, I think, is bigger than all of those because of the economy being shut down and because of the social distancing, which makes it harder for people to stay connected. But we got through that, and we will get through this. We have to be one New York. That is what we need. Our kindness and compassion and creativity and ingenuity, that will get us through this. And I'm really grateful for all the work that you're doing, Lori, every day to bring this important information to New Yorkers.
All right, well, Tuesdays with Corey in a different way. Thank you, Mr. Speaker. Appreciate you being with us. Stay well.
Stay safe. Stay safe.
You too.